All right, welcome everyone. If you would benefit, for those of you who will benefit from using captioning, we do have the speech recognition captioning turned on. Our captioner has not arrived yet, and as soon as the captioner arrives, we'll go ahead and turn on the captioning at real time, or the captioning, closed captioning. We'll share that website. Welcome everyone. Oh my goodness, it's been a very busy month. I can't even get over it's been a month. That came by really fast. So welcome everyone. This round we are actually not having a presenter this round, and so before we get started, I wanted to see if there was any new participants, or maybe those who haven't been here in a while. If you could please reintroduce yourself, and we could go from there. Go ahead and unmute.
Hello, I'm Daryl Schaefer. I've been hit and miss in these meetings. Sorry to miss a few, but I've been a little busy with schoolwork and had to do a presentation down in Hawaii at the Disability and Diversity Symposium, PAC-RIM. That was a lot of fun.
Nice, thank you, Daryl. What state were you in again, Daryl?
I'm in Alaska, in Fairbanks. And
okay.
So we had 100-degree temperature change from -23 to +80 down in Hawaii, Honolulu, where I did the presentation. It was challenging. It was fun. And yes, I got a little sunburn. As you can see, the tan line and all that sort of stuff.
That's interesting. I love that story. Yay.
Yes. But it was a lot of fun. My presentation. What was my presentation? I'm doing a paper on right now. How the vulnerable population are not as vulnerable as assumed. So I'm writing my paper for the conference proceedings for that, and hopefully it'll get published next year.
That is awesome. I love that. Yay. All right. Any other newcomers or those who haven't been here in a while? Mike, would you like me to what would you like me to ask call you out there?
Yeah, it has been a while. Hey everybody, this is Mike Houston. I'm the FEMA Region 8, the Regional Disability Engagement Specialist for FEMA Region 8 in Denver.
Yay. All right. All right, just one final call out. Any others that are new or haven't been here in a while? Okay, well, we're going to start out with asking, are there any needs right now? Right before everybody joined, there was a call out to ask about some resources for an active threat or an active shooter for children benefits. So I'm going to look those up as we're doing updates in here, so I can make sure you could get them in the chat, as well as I'll email them out in the notes and stuff like that too. With that, and Heather, do you need any other resources that you could think of that you're needing?
No, Sadie, I think that would be good. I just know during the last Active Assailant event, we shared that out and it was very useful to people. So I'm going to send that to my sister and her team in Nashville.
Okay, perfect. Yay. Okay, let's see here. One moment, please. Alrighty, sorry about that. And I'm checking on the captioner also. Alrighty. looking for some resources for children with an active threat. Any other events that are happening out there that anybody wants to report out on? Quiet group today, maybe not or so far, but we're going to get into a topic conversation. But I want to see if there's any highlights, concerns, anything on your mind, any needs or rumors that are happening.
Well, now I'm interested. What rumors have you heard, Sadie?
I don't think I have any rumors. Let's think, any rumors that usually what happens with the rumors is like, for instance, in COVID, there was a conversation that came up that said that, hey, we could waive people with making things accessible for people with disabilities. And so there was a conversation, and there's even a form that goes out that emergency managers sometimes don't know the information. So then what they do is they go on a rumor. For instance, the lawsuit that's happening right now, or that's filed against Texas, one of the questions that came back to me from some of our emergency managers is, hey, if we don't have the resources available in our community, how do we get a waiver to not have to provide those resources? And so it's like, there's never a waiver to leave people out. And so that's what I mean by a rumor. Was that helpful, Lynn?
Yes, ma'am. Not nearly as spicy as I expected, but very helpful.
Makes sense. Yay. All right. Okay, let's go on. Some of the other information that we wanted to do is we actually wanted to bring a discussion session up, because as when we ended Kurt, just making sure you were meant to send that to me directly, or were you wanting to send that out to the group?
I thought I'd send it to you first.
Okay, yeah, they're really looking for specific for children, and it's the one that Amy Seaver sent out after the active threat in the fall. And I was trying to find the email where I sent all of those resources out that I'll share before the end of this meeting. If not, I'll send it out right after to the group.
Okay, I used to run after school programs, summer day camps, and I was the person that did all that planning, trained the staff, did all that. Excuse me.
Awesome, thank you. So Kurt is another great resource if needed. They really just wanted to share those. I think the behavioral health and mental health resources for children and experiencing that for right now. But good to know. Thank you. All right. So when we ended last month, we started talking about what, and especially after the conversation with our national partner that presented out last month, we wanted to get a little bit more information on what our group wants to learn from. And there was 4 different areas that our group was looking for. It was the intersection of ESF 8 and ESF 6 and how they mix with us in ESF 5 in emergency management. And so the other one was ASPR, the Healthcare Coalition and Emergency Management Intersections. And then the next one was the equity groups and FEMA and how they intersect with whole community inclusion in emergency management. And then emergency management service, emergency preparedness rule, how it enforces 17 different entities under the rule. And so as we looked at that, those are all extremely broad. So before I reach out to try to bring those partners in, I want to look at the what of it, the so what, and the now what that we want to bring to this group, so that we're just not given high level information and then it's not a resource or a program that really will help us as we do that whole community inclusion and emergency management. It's not going towards like a specific area and then we're not knowing how to even request that resource. And so is there one over the other we would like to start with? So for instance, I'm gonna put all of this into the chat of what we asked, and we sent this out in the notes last time. And so I'm gonna put this here. All right. And this is what I'm referring to. So I want to know if we want to start with the intersection of ESF 8 and 6 and do the what, so what, now what, or the ASPR Healthcare Coalition Emergency Management intersection. And I know that for the what on that one, we wanted a better understanding of the Healthcare Coalition's purpose. And then we can move into the so what, now what on that one. And then the equity groups in FEMA and how they intersect in whole community inclusion and emergency management. And the what there was community prep team and how they work together. And then under the EMS emergency preparedness rule and how it enforces 17 different entities under the rule. Two questions that came from that was what is the impact and how is it working? And we can move that into the what, so what, now what. So anybody want to start? Go ahead, June.
Yeah, I'll start because the last one is a little more specific for me. The others are they're so broad and they overlap quite a bit, as does the emergency rule. But as a member of that ASPR National Advisory Council on individuals with disabilities and disasters, we were actually tackling all of these, but the emergency rule came up quite a bit. And so the questions are around what is the enforcement like, you know, for all of these 17 different entities? Is this one more time where CMS passes the responsibility to the state, or do they take on monitoring responsibility? And if so, where does this happen? How does it happen? What are the corrective action plans like? Who oversees these? And, you know, how are they measuring success with these? So again, those are still kind of vague, but the emergency rule is pretty big and pretty broad, and a lot of us don't understand the details below it. And those are just some of the many questions we have related to the rule. Who is the real enforcer? Who really looks at the granularity of the plans and the corrective action plans, if there is such a thing? Are there site visits? How does this all happen? Or is it kind of theory only? So that's a start.
This is Sadie. I didn't even capture them all. I'm gonna have to go back to the transcript to grab them, but I did capture the majority of them, so I'll make sure we have all of those in there. In that, so those are great starting points. Any others when we're coming to the EMS preparedness rule and how it enforces 17 different entities under the rule? Is everybody familiar with it? Now, that's okay if we're not, because that's why we bring people to come in and be able to help us better understand it. And how we work together on it. I'm familiar with the details. Interested, okay, perfect. All right, well, we're definitely, because we're not familiar with it, also, I'm semi-familiar with it, and I want to know more as well. And I love when we have subject matter experts like June to help guide us to better understand it also, as she asks all these really excellent questions as we do that. All right. Okay, let's look at now the intersection of ESF 8 and ESF 6. And I know I just saw who is in my audience here, and my subject matter expert in ESF 8 here at the state of Colorado is online also. So Amy, just in case, I might be lifelining you in some of this, if you're all right with that. Our last meeting, and just because I think you might have missed the first part, the last meeting, we wanted to understand a little bit better what is the intersection of ESF 8 and ESF 6. And we want to bring presenters in to help us understand the what, the so what, and now what when it comes to that intersection. And so we're trying to identify some questions to have ready for those partners as they come in and talk to us.
Hey, Sadie, it would be helpful because we're not all sophisticated about this. I can't even remember what 5 is. So
Okay.
going over 6, 8, and 5 for everyone, so at least we're on the same page would be helpful.
Yep, good, a great, excellent. I love it. Give me 1 second and I will bring those up. Okay. And I'll share this out, the link as well. All right, for emergency support functions, what happens in those in emergency management, there's a lot of emergency support function agencies that support in these 15 different areas. These are the FEMA areas normally, but ESF 5 is information and planning and emergency management is where emergency managers come in, the coordination of emergencies. 6 is mass care, emergency assistance, temporary housing, and human assistance. And 8 is public health and medical. And then there's also support agencies that come up in there. And so those are those areas. And this is from the EMI Academy. So this is going to show it a little bit different. I'll try to find a different link as well. But this is the Emergency Management Institute is the EMI is what I'm referring to there. And then normally in here, there's this one's even better here. So we could show you where the ESFs are. And then inside these emergency support functions, this is what they focus on there. And then there's also lifelines now that these are the organizations who lead these ESFs, emergency support functions. And then there's lifelines when we come together to try to be able to reach community without it being in silos, like not my job, ESF whatever, ESF whatever. It brings us together so that we could all come together and nobody's left behind is the desire behind it. All right, Michael or Amy, would you add anything else on what I just explained?
The only thing I would add, this is Mike, is sometimes the states have more ESFs than the federal government. The federal government has 15. I've seen some states have like 18. So, but yeah, no, that's an important part of the emergency response. Everybody has a particular expertise, and that's where those missing assignments come into those other ESFs.
Right. And then this is also some information on why they were designed, the lifelines were designed, at least. I know some of our counties some of our counties are actually providing up to, I'm thinking of our Boulder County, I think they have 32 or 35.
And this is Amy. I would also add that within a single ESF is often multiple types of partners, especially I can speak to 6 and 8 voluntary organizations active in disaster on top of maybe governmental human service partners, include sort of the large gamut of ESF 6, and I'm sure there are more than that. ESF 8 includes public health, healthcare entities, has parts of this work that are kind of organized by which service provider is engaging in what part of coordination. So just even within sort of these big conceptual ways that we get organized, it breaks down into even sort of further pieces when it comes to who's responsible for which piece. And I do not profess to be an expert definitely across the country and even within our own state, but as I understand it, there are parts of the EMS rule that are certainly related to obviously disaster planning, but is also because it's a expectation of facilities receiving Medicare, Medicaid funds from the federal level. There are, for instance, sort of regulatory agencies within maybe a state department who do site visits. And while the disaster planning part of it is one component that they would be regulated on, it is just one chunk. And so the regulators, how much time they spend on that plan, how much expertise they come in with, or the administrator of the facility has specifically around that one part that is being evaluated at a site visit, might determine how much attention this particular rule gets in those interactions around, does the plan exist? How good is it? What are the means by which we are sort of ensuring things improve over time? There's just a lot of factors and awareness that play into that. I would offer as sort of one piece of it. For our state, there's somebody, for instance, that even though I work hard on ESF 8, I would maybe want to talk to about how they do those site visits on a regular basis and how much of the disaster planning is really factored into that. And I know that the healthcare coalitions that are being supported by HHS ASPR often become a place where those facilities can get some technical assistance or support and exercise opportunities for the plans that they put together. That was my brain just downloading a lot of stuff all at once. So I think the runaway message that I wanted to leave people with is that there are multiple moving pieces and maybe multiple places where either the development of those plans, the technical assistance and support for those plans might be happening in sort of multiple pieces and multiple stages.
Thank you, Amy. Go ahead, Laura.
This is Laura Sturmel speaking. Can you hear me okay?
Yes.
Okay, great. I think it's crazy to try to understand all these functions, unless you work in emergency management, but I could talk about what happens in Delaware with a very specific example that might make it more easy to understand. So if someone arrives at a shelter, after a flood disaster, who may have had a mobility device that was lost or damaged. They show up at the shelter, which is mass care, ESF 6, and public health, ESF 8, would be notified that a resource request would be needed to try to help that person to replace their equipment. So in Delaware, we would get the shelter manager sending messages back to our state health operations center. I work as the at-risk population supervisor, that's what they call it here, would be working with a group of stakeholders we call the functional information support team to try to locate that person replacement equipment temporarily as quickly as possible. And eventually, if we get them something on a temporary basis, connect them with human services or social services to find, you know, a permanent replacement. So that's just like a quick example of how it would work in Delaware. And it may be completely different in other states or localities. But there's several functions all happening at the same time to get that person a piece of equipment that they may need. I don't know if that makes sense.
This is Sadie. Yeah, so I'm going to write down what we want to learn is what is the process from one to the other, and when does emergency management need to come in for the resource request process? As one of the what we want to learn from that collaboration, even though is it different in each of the states, or, you know, and if it is, how do we better understand that? So does that work as one of the what's for the what? So what now, what kind of thing?
Sadie, this is Deltrice.
Hi, Deltrice.
Hi, I think what you just said, it might work differently in every state. I am the ESF 6 lead, and I'm the state mass care coordinator in Arkansas. And you just made a point was you were looking for when does emergency management come into play for a request. Well, for us, after a declaration, any request that a county needs, it's going to come through our emergency management agency. And they're going to send that request to the appropriate ESF to fill the request. And in Arkansas, ESF 6 coordinates sheltering, mass feeding. We assist with disabilities and access and functional needs, reunification, housing, service animals and household pets, distribution of emergency supplies. I might have left something off, but back to for our state, ESF 6 is responsible in emergencies at the state level to coordinate AFN. And so when someone needs something, it's going to come to ESF 6. But when you were mentioning earlier about the overlap between ESF 6 and ESF 8, the CMIST is in both ESFs. And so, you know, there's a lot of overlap. Yes. And so I just wanted to mention that, but try not to muddy the waters too bad.
This is Sadie. You brought up a good point that in each state, access and functional needs is only looked at in certain ESFs as well. I'm going to go to June and then to Michael.
Yeah, I love Laura's example because it is so specific and not, you know, we don't get lost in the rhetoric. So I want to go back to her example and just dissect it a little bit, because this is where all havoc can break loose. For example, maybe you can get somebody a temporary wheelchair, a manual wheelchair. But if they're a person that relies on a pretty tech complicated, rehab heavy power chair, that manual chair is not going to do a whole lot for that person and will indeed continue to put them at risk, i.e. ESF 8, which is medical, they'll think, well, this person can't maintain their health, their safety, their independence. Therefore, we better find an institution for them. So the example that Laura gave is great. So you get them a temporary something, and then you refer them to wherever, depending on your state, to help them replace what they had. Well, the reality is that repairing and replacing what you have on a non-disaster day is a horrendously difficult, painful, and long experience. So I think we need to infuse reality in our stories because, you know, 8 doesn't recognize this. Sadie, you had a presentation in these meetings several months ago by ASPR about replacing DME in emergencies, right?
Right.
And frankly, as somebody who's delved into this very deeply, it was very theoretical, but it wasn't based on reality. So I just want to make sure our discussions really go to the concrete layers. And that's why I like Laura's example, because that helps us make this discussion real.
I love that. Go to the concrete layers. Okay, and I'm just gonna repeat just because I was asked to right after Michael. Go ahead, Michael, and then I'm gonna repeat what we're doing with today.
I gotta keep my comments to a minimum. There's so much we could talk about. We could talk for hours on this. So I'm just curious, maybe a broad question to everybody on this call, especially those in the ESF 6 and 8 world. Are you, or do you currently, when you, like Laura, you mentioned if somebody walks into a shelter or Deltrice, you're talking about in Arkansas, if something happens where ESF 6 or 8 has been mandated, do you guys participate in the WebEOC platform? Do you contribute to that? Do you do requests for information, RFI, or missing assignments? Because if you do, that's a great place to capture all that.
Yeah.
So
Yes.
that they're not losing things like operationally, because at the state, you know, you have so many different divisions right across. You have business management, you have mass care, public health, transportation, whatever. But if you're catching that in the WebEOC, that helps us to like consolidate. What did we do well? What did we not do so well in this disaster? And then secondly, somebody brought up a point, ICS, NIMS, ESFs, all of those, it was more of a structure. There's just so many people come to a disaster and everybody's doing things, so we're trying not to duplicate efforts. So that's another reason why I brought up the RFI, the missing assignments. How are you using WebEOC? So like somebody who's in a shelter and they got a loan or a wheelchair, how do we capture that so we don't make sure if FEMA comes in and duplicates those efforts, or maybe what they may have been qualified may have been disqualified because they got some other help, whatever. I'm just throwing weird things out there. But I think really getting everybody on the same page around WebEOC is really the key, especially if that's what is utilized in your area. So I just wanted to throw that out there to kind of see what people engagements are, and that might be a preparedness opportunity of building capacity within EOCs.
This is Sadie. That's what Amy actually put in there, Michael. Same kind of thought process there. Maybe asking what happens in the planning and preparedness process that we can program for the ongoing improvement, and what happens in the response process to navigate the needs that cross-cut in the various ESFs. And I think that could get captured in asking that in the what when we have the subject matter experts in there.
Yes, this is Laura speaking. We use WebEOC, which is the electronic system that tracks all resource requests. So that would go from the shelter manager back to the emergency operations center, put into WebEOC, and then trickle back to me at the state health operations center on the public health side. Yeah, so they're all tracked, so you can kind of see if that falls off, or what the progress is with that resource request. And also on sunny days or gray days or whatever you want to call them, with our stakeholder groups, we're really trying to get people to think about their equipment, and write down manufacturers, batteries, all that good stuff, so if something does happen to their equipment, they can share that with whoever's making these requests. So that's another preparedness type planning thing that we work on with our stakeholders.
Yeah, and so what we're asking in this conversation, just to go back to reflect in case those of you who may have jumped on a little bit later. At the ending of our last presentation with bringing us resources and how to work with those resources, we were asking 4 different areas that we would like to see come in to present with us and help us learn from, plan with. And that is the intersection between ESF 8 and 6, the ASPR Healthcare Coalition and Emergency Management intersection to get a better understanding of Healthcare Coalition's purpose, equity groups in FEMA and how they intersect in whole community inclusion and emergency management, and what PrEP teams and how they work together. Emergency management services, emergency preparedness rule, and how it enforces 17 entities under the rule. And so that's what we started out with, getting some of the what, so what, now what, under the EMS preparedness rule, so that when we bring in those partners. Did that help clear up for some of those who have come in late? I'm going to put this again into the chat. I put it in earlier just so that you could see where we're going with that. And the reason why I'm asking this in a format of what, so what, now what, is so that we can look at the solution focus of it, looking towards a solution focus of it, not just identifying the problem of it. So that we could better get processes, maybe good and promising ways of doing this where and successes and then also fails, so that we can learn from both of them as we keep growing, or I'm sorry, not fails, but areas that really need improvement or in that. So does that help with what we're doing with that? Okay, I'm hoping so. If not, put it in the chat and you could direct message me if that works as well. All right, so I think I captured a lot of what we want to learn from the intersection of ESF 8, ESF 6, and also the emergency preparedness rule and how it enforces 17 different entities under that rule. Let's move into the ASPR healthcare coalitions and emergency management sections. What we want to learn is a better understanding of healthcare coalitions and purpose. What else do we want? What do we want to do with that? Are there questions we want to ask healthcare coalition purpose? Go ahead, Daryl.
I think one of the key questions that might need to be asked is, what are the expectations from each side? Because that's one of the things that I've found in some of my research, is that there's an unrealistic expectation from one end. And many times it actually comes from those with disabilities, that I have a disability, I may have been registered in your whatever call system, and so I'm expecting the healthcare coalition to take care of me immediately during a disaster. And that's not going to happen. You have your items notified, and the healthcare coalition understands that, but in emergency management, they're looking at everyone, and you may not necessarily be the number one victim of the whole situation. So I think getting the expectations from both sides will be a critical one at the beginning.
Awesome. Amy, I'm calling you out again. I'm sorry. Is she still on? Yeah, there she is. Amy, there's a process that you work with at the state of Colorado when it comes to grant funding in healthcare coalitions. And some of the questions I think might help in this when we ask healthcare coalitions is, how, what are some best and promising practice to reach the whole community with the public health emergency program grant funding, and then also the hospital preparedness HPP grant funding. Sorry, I don't know what it all the way stands for, because you're doing some very inclusive deliverables here in Colorado for healthcare coalitions. Can you think of other questions that that as we bring that subject matter expert in that would help us in emergency management better understand?
This is Amy. Two starting points that I think are helpful for, I really appreciate this conversation about expectations. The Public Health Emergency Preparedness Program and the Hospital Preparedness Program, or otherwise known as the Healthcare Preparedness Program, as it has expanded, certainly beyond just hospitals, among healthcare providers that participate. They are both federally funded programs that have capacities that are intended to be developed by the administration of these programs. And so in terms of sort of knowing the language and the expectations that those preparedness programs are really trying to develop, I would highly recommend getting familiar with the capacities, or sorry, the capabilities that both HPP and FEP put forward. And I'm happy to go find those links and add them to the chat for people to review, because in terms of there's certainly synchrony and an alignment between the capabilities that emergency management uses as their core capabilities, and then the ones that are highlighted in these programs. I think they're not the exact same, but they speak to each other rather well in terms of saying within these partners within this sort of larger area of ESF 8 readiness, we believe these are the capabilities that we need to really be developing. And what we have found over the years is an increasing amount of language about community preparedness, the use of the access and functional needs concepts, even the CMIST memory tool within those sort of capabilities. And because that is a federal, because those are federal capabilities and grants, once again, we have the phenomenon where each state kind of transforms, what their focus and their sort of organizational and coordination language is that's really moving forward. So obviously here in Colorado, it's been a great thing to have the collaboration and focus on access and functional needs that Sadie, the creation of your team has helped us really reinforce. But I apologize, I may have missed the question, and there are, I think, additional questions to be asked, but I think in terms of some of that context building about what the grants intend to develop as capabilities and where that overlaps, where there's potential for that to work with access and functional needs, inclusion and attention, starting with those capabilities documents is really helpful.
Love that. Thank you.
And this is Mike, just a quick follow-up question for Amy. What you just talked about, is that at the state level or is that also included at the county level? Because I know a state I deployed Montana last year, all of my counties are different, right? All of the public health offices, the capacity is really small. The emergency managers are really, really small footprint. So are you talking about state or are you also talking about counties? Because I would also throw in potentially if the state, and it's part of the thyro, right? We're doing that SWOT analysis of our counties, where the strengths and weaknesses are. How then do we bring up the weaknesses, especially in the more rural parts of our country, as opposed to the big metropolitan areas, right? So I was just curious, Amy, if you were alluding to the state level or does that also include counties?
Yeah, so the FEP and the HPP grants are both administered or passed through our state Office of Emergency Preparedness and Response. And then those, a significant chunk of those dollars are then passed through to either the regional healthcare coalitions or to the county public health agencies. So yeah, the activities are very much a sort of like sub-recipient relationship of at the local level and the state level building towards the capabilities that are named in the document.
Perfect. So we should put that into the, you know, as we learn from them, we'll better understand that and learning from each other on that. All right. Any other questions that we think that we should put into ASPR healthcare coalitions? Alrighty, right, just in case. Go ahead.
June, my understanding is that these coalitions are very, very different, just like independent living centers. If you've seen one, you've seen one. And some of them are inclusive of community partnerships and some are not. I think that's a big issue for a lot of us. Are they just about the medical and the acute care in nursing homes? Or are they more, do they have a broader lens and inclusive membership? So I think the basic question is, if you look at their enabling funding and where it comes from, it's very broad what they can do. It doesn't mean that's what they do. And so it's kind of hard to talk about them under one blanket because they're all so different. So I think we have to, you know, kind of recognize that what do we want from our own healthcare? What's it look like where we live? You know, how inclusive are they or not? What's their focus? You know, I don't am an expert, but I hear that funding is a major issue for many of them. So anyway, all of those details are really critical.
This is Sadie. I love that. Thank you. All right. I'm going to move on now to equity groups in FEMA and how they intersect in co-community inclusion and emergency management. One of the what questions was community prep teams. How do they work together? What are some other questions we want from that equity groups in FEMA and the intersection?
You please define community prep team. What is that?
This is Sadie. I can't remember on our last meeting who brought this up. Was it you, Sue? Sue, did you bring that up or was it? Ooh, I can't recall right now. I thought it was you who brought up the equity groups.
It may have been me, and I need to apologize in advance. We seem to be having power outages here in this part of Massachusetts, so I may fade out. I've already been tossed off and on. My question was, and I hate to be so naive, I have presented to an equity group, but I do not understand what their purpose and function is. They were certainly lovely people. They were personable people, but I didn't understand what they were to do before an emergency and what they were to do after an emergency. So that's my question about them. The healthcare coalitions, my understanding, but this could be totally.
I think we're going to blend if you go back to healthcare coalitions.
Sorry.
We're in equity groups and FEMA. I just want to be real careful with that because I think we'll get blurry.
Thank you for correcting me. So as I said, I just don't know what they do, and I would be curious. And again, what their intersection with other groups at FEMA might be before, during, and after an event. And I don't know, Mike, if you have the answer to that question.
Yeah, this is Mike. So I just had a regional equity working group meeting before this meeting. And one of the things I keep struggling with when we say the word equity, what do you mean by it? What is the end game of equity? Are you talking about racial inequities? Are you talking about disability inequities? Are you talking about employment inequities? Are you talking about economics, transportation? I mean, equity can be, in my opinion, there could be, if you're talking equality and equity, but if you're talking equity as the Biden administration executive order, it's racial inequities as it relates to the vaccine. We don't want anybody to be unapproachable, as it were, as it relates to the vaccine effort, right? So that broad statement was about racial inequities, but Section 504 talks about equity. The Section 504 implementation plan that FEMA implemented or has signed off by the secretary in 2019 has the word, has equitable equity concepts in it. So now what's happening, Sue, to your point, is that all across FEMA, we're being told to do equity in all of our various program areas, whatever that job might be. And they don't have any prior training to that, or they don't have any prior thought as to what that means. And now they're having to kind of come up with their own definition of what equity is. And I'm just, my comment today is that we need to stay focused internally. What can FEMA do and what FEMA can't do? At the regional level, at the disaster response level, we're not creating policy. We're simply delivering policy. Policy has been created at headquarters under the directorate. So what gaps we find, that's why I made the comment earlier about Web EOCs, is we need to identify where the pitfalls are that are happening, one-on-one, when we are talking with survivors or populations. And if there is a inequity right there, it needs to be captured and it needs to be sent back to the directorate to change the directorate language, which then goes back out into the field, and employees have an expectation, a behavior expectation about XYZ topic, right? So I think that's the biggest issue with equity is, A, we don't have a clearly defined equitable statement. What do we mean by it? And then secondly, is it federal, is it state, is it local, is it your home? There's so many jurisdictions. Everybody's coming up with a different equity statement. And I just think we need to be focused on, and I try to say, and I'll set up real quick, 3 different people groups. You got your protected class, people with disabilities, and that also could be race involved. It could be gender, it could be sexual identity, whatever those things may be. You could also have, your Title VI of Civil Rights, that's language, national origin, all of those fun things. And in between all of that, you have your access and function needs, which is such a diverse universe of people and needs and unmet needs, right? So I say all that to say this, I think we need to identify what does equity mean? And then if we're talking about inclusion, if you're doing one or the other, I feel like you're going to be doing, if you're doing inclusion, you should be doing equity. If you're doing equity, it should also include inclusion. It seems like they're different pillars of activity, if you will.
I totally agree with you. I met with a group within FEMA Region 5. So I guess they were federal employees, to your question. They called themselves the Equity Group. Again, they were delightful, but I didn't quite understand what they did. And I assumed, and maybe I'm wrong, that every region had such a group. Maybe it's unique to that region and I just didn't understand it.
No, Sue, we have equity groups in the region. We have equity groups that form in a disaster specific, if that FCO, the federal coordinating officer, so desires. But on the other hand, the states, the federal government cannot speak for the states and vice versa, right? I just think it's so important to understand what is the state's definition of equity, and that includes ESF 5, emergency management, 6, mass care, 8, public health, and everybody underneath all of those banners, right? What is your equity statement? And then from that, we should be able to see where our strengths and weaknesses are. And that's been my push in FEMA, is to understand as a directorate, where are some resources that we're lacking? Sign language contract, transportation contract, shelter, whatever those things are, we need to know where the strengths are so that we can put forth the equitable equity effort. If I could borrow that term. Anyway, back to you.
Thank you. All right, June.
I think we're getting seduced and tangled up in a lot of rhetoric. Well, it doesn't matter, forget FEMA stuff about equity, we need to define the problem and how we work toward the solution. Forget all this rhetoric, we can go down this rabbit hole for a lifetime. What are the problems and how do we get to a solution? Forget, let's not talk about these vague concepts. Let's talk about the problem and potential solutions, just like Mike said. Let's not get wound up in this. We'll never get anywhere with the rhetoric.
Yeah, thank you, June. This is Sadie. Because it starts making a spiral. You're exactly right on there. And I think if we do ask that question, can you tell us what problem and what are the solutions you're working toward in those problems? We'll be able to identify what areas there are resources lacking in equity. We'll be able to identify is that at the federal, state, local, title state, where is the focus in there? So I love that idea. All right. With that,
Sadie, I think we need to tell them what the problem is,
Yeah.
not them tell us.
so now that you said that, maybe we definitely have identified some of those areas in there, which are lacking resources, right? And Michael gave us a lot of those examples. We could start with that if we're all in agreement, or do we want to add some other ones?
I think, Sadie, too, if I can just throw this flavor in there, is the states have a cost share with the federal, if the feds come in, FEMA comes in, right? There's a cost share involved. And if the states can build more MOA arrangements, memorandum of agreements or understanding with community-based organizations, and it gets written into the hard plan, there may be more opportunities potentially for reimbursements for the public assistance program, so that more companies, more community-based organizations in that company may get involved, right? It may be ways that emergency managers don't know about this, all of the different infrastructure about how we can do that, how can we build that capacity? And so I just think it's, yeah, anyway, again, I could talk for hours and I know we're running out of time, so I'm gonna be quiet.
No worries. Thank you. That's a great idea. Real quick, if everybody can please put into the chat their name, organization, and the name, their state, and their organization you're from, just so that we could capture for we usually do attendance, and so yeah. And then all right, with that, I think I've captured at least a path forward on when I ask our partners and find them that what we're really asking in there, so that we don't do what June had described there, because that doesn't do us any good. We get confused, and I think that's probably, Sue, where you got confused even in that equity group, where it feels like what is this kind of thing. So all right, with that, we have about 2 minutes left. I want to shout out anybody who has any final thoughts, comments, questions, and then this at least will help me plan for our April meeting. I think at the beginning, Heather was looking for her resources, but she did find it and she shared it in there. And Amy, these were resources that you shared after the active threat that we had for children, for adults who are supporting children, the role of caring adults after an active shooter piece, an active shooter incident. And I think you found it, so I don't need to find that, but I will include it in the notes as we share it out. Any other items? Any final comments, questions, concerns? With that, I would want to thank you all for taking the time to join us as we continue to plan with, learn from, and keep growing in this group. Great conversations. Love having the subject matter experts in here, because we could see how Plan 4s can get out of control.
Have a great day, everybody. Great to see everyone.
Yay. Yes, great to see everyone. stop recording, please.